So there's this pretty fascinating observation in lymphomas and other diseases where the longer the delay between the clinical diagnosis of the disease by the pathologist and the administration of the curative intent or induction intent therapy, the longer the delay, actually, the better the outcome, which seems a little bit counterintuitive when you consider that delaying a treatment might result in worse outcomes. So we and others have been interested in what this is measuring. Of course, hindsight is 2020, but can you look forward and say what is contributing to the decisions that lead to the treatment of some patients more quickly than others? And so we did this in looking at blood specimens from a substantial number of patients from North America and Europe, both who are undergoing treatment of lymphoma as part of a large randomized clinical trial, the Phase III clinical trial called PETAL, and then separately during standard treatment of diffuse large B-cell lymphoma with standard of care therapy at a number of academic institutions. And the basic observation that we were focused on was, what is DTI measuring? And is it about tumor burden? Is it about how quickly the tumor burden is changing and things like that? And the striking finding was that DTI was largely measuring tumor burden, but of course also measuring other things. The reason that an oncologist makes a decision to delay treatment could be about institutional resources and practice patterns, such that DTI, for example, in certain parts of Europe were longer than certain parts in the US, even though the circulating tumor DNA levels were very similar. So I think what this means is we found an objective measure, biological measure for what DTI is about, or at least what the adverse prognostic impact of short DTI means. And I think that means that we have opportunities for use of circulating tumor DNA before the start of therapy for better stratification of clinical trials, so that we can compare apples to apples by more consistent measurements of circulating tumor DNA levels.